Good morning. I'm Kimberly Dryden of NCW Insurance. The clock is ticking very loudly on the mandatory health coverage demanded by the Affordable Care Act, also known as Obamacare. These coverage requirements will apply to health insurance in 2014. That may seem like a safe distance away, but consider that the rules are supposed to be in place at the annual enrollment process. This will begin as early as July or August at some employers, and later in the fall at most organizations. NCW Insurance has a desire to be more in our relationship with our clients and providers of insurance. We want to be a resource for you. Today's seminar is just one example of how we want to bring to you information that does not necessarily impact your insurance costs, but does impact your business decisions. As there are new developments, we will send you that information, so please be sure that you sign in so that we have your contact information. Also, we have planned a fall seminar as well. The information today will be focusing on what you need to consider in the very immediate future. The fall seminar will focus on new developments and the next steps that employers need to be considering. Our speaker today is Misty Baker, the Director of Health Insurance Services at the Independent Insurance Agents of Texas. Previous to this position, Misty owned her own health insurance agency for 10 years. Misty's focus for the past 2 years has been the Patient Protection and Affordable Care Act. And like many of our legislators, Misty has read the 2,000 plus pages of the bill and reads hundreds of pages weekly regarding the Affordable Care Act. Misty educates and researches health insurance issues for the independent insurance agents, Texas legislators, and regulators. In fact, I understand, Misty, that you are going to testify in front of the Senate State Affairs on Monday. She has spoken to many business owners, human resource professionals, and concerned citizens about the Affordable Care Act, and she has a unique perspective on real problems that the Affordable Care Act will impose and creative solutions to help employers keep providing affordable health insurance. Please welcome Misty Baker.
Thank you for having me. All I do in my professional life these days is talk about health reform. For the last 2 years, I've devoted my entire life to reading the bill, understanding the bill, and trying to give you enough information so that you don't have to read all 15,000 pages that have already come out with regulations. If you have any questions today, anything at all, I want you to stop and ask me. I am a complete open book. I'll tell you anything I know. I might speculate a little bit on the rules that we don't actually have in writing yet. But I want you to remember that I'm an unbiased person. I'm not here to sell you anything. I don't work for any particular carrier, so if you have a carrier question or concern, I'm very familiar with what they do as well. So ask me anything that you choose. I've probably heard it all. Well, actually, I say I've heard it all until someone really bright asks me something really good. So first things first, just relax just a little bit. We're going to scratch the surface of health reform today. We're going to go over about 10% of the things that are actually written in the rules in the law currently. I mentioned 15,000 pages. That's true. It's about what have been issued to date. Normally around Friday at 4 o'clock Central Standard Time, the government thinks it's really funny to put out more regulations so people like me, lobbyists like me, who actually read stuff and then try to interpret it for you, get to work all weekend and read the pages. So sometimes it's 700 pages. Last week was only 46, so I actually had a weekend last weekend. You'll see about 1 million pages issued before it's all said and done. So what I say today could be changed with a rulemaking authority in the future. And I've seen this happen many, many times. HRA rules, for instance, were one thing, and now there's something different. I do expect some more changes in the future on those as well. So there's really 4 major entities that are controlling our health reform life. The first one is the Department of Labor, IRS, HHS, which manages mainly the marketplace or exchange piece and Medicaid piece, and CCIO, which is CCIIO, which is a brand new insurance entity which was created by health reform. Let me time out for just a second and say, I say health reform You may call it PACA, or ACA, or PPACA, or the Patient Protection and Affordable Care Act, or Obamacare. Whatever you call it, there's a lot of things that people want to call it from time to time. So I usually say health reform. If I walk into a legislator's office as a lobbyist and I say, darn Obamacare, they're going to know exactly where I sit on the website of the fence I sit on. So I try to remain as neutral as possible. So let's go over some basic highlights of what's going to happen with health reform. And really, most of the juicy provisions for health reform kick in January 1st of 2014. Now, not everything is exciting as I'm going to make them out to be. Some of these will impact your business far less than it will impact someone else's business. The one thing about health reform to remember is this. Your story is different than the guy sitting next to you. The way you do business is different. The way you interpret hours of your employees, the way you pay people is different. So some of you run a restaurant. You have a lot of variable hour employees. Some of you are engineers and your people work for you every week, 40 hours a week. Some of you have people in the field. Some of you have 12, 13, 14 states that you do business in. So health reform is not a cookie cutter law at all. You're gonna need a consultant to help you move through this process. It is extremely difficult. And every day, or every week, as new rules come out, it gets more complex. One of the things I want you to take away from this seminar today is this. Every American and U.S. citizen in our country will be impacted by this law from January 1st of 2014. I don't care if you have an individual plan, if you have a small group plan, self-funded plan, no insurance at all. Every one of us will be impacted. Nobody's talking about that in the news. So when you go and hear rumors, or in your church group, someone might give you a fact about health reform, or talk about a death panel, or talk about Medicaid, and find your doctor's not going to take things. We're scared because we don't know the truth. We don't know what's happening. First highlight of 2014 is this, and every morning between 7 and 8, I call the governor's office. I don't get to ever speak to the governor himself, but I have one contact, his name's Ryan, and I say, Ryan, are we expanding Medicaid in Texas? Same answers every day. No, we're not, Misty. Quit stopping me. He actually mentioned a restraining order. I took him to Starbucks and I said, don't do that. I got some really bright ideas. So Texas will not expand Medicaid. Some of you may think that's a good thing. Some of you may think it's a bad thing. I'm not going to try to be too insurance-y with you today. There are very good reasons to expand. There are very good reasons not to expand. The first very good reason not to expand is called our budget. Right? We would basically have to open up Texas's checkbook at a general revenue or some other place and write a huge check. And when I say huge, I don't know how big that check would be, but it's going to be pretty large. So we are not expanding Medicaid as of yesterday because I didn't call this morning. I'm sorry. I gave Ryan a break on Friday. I'm sure that we would have heard by now. I would have heard. I probably got a big text alert. You'll also see that every U.S. citizen and every legal U.S. resident must now have a qualified health plan. If you do not have a qualified health plan, then you will pay a tax. Now, when I say tax, you could insert the word penalty or fine. I'm going to call it a tax today. So depending on where you are in the political spectrum, you might want to say, well, she really meant a penalty instead. You'll also see health insurance exchanges come online. We're going to talk about these exchanges in depth here near the end of the presentation. You'll see premium subsidies also happen inside the exchange. Remember when I say a subsidy, I mean somebody had to take money from someone else's pocket, wallet, bank account, and give it to someone else. It's a pass-through. Now, the way we find that money for subsidies is very creative. I'm going to go over a couple of the new taxes that would create those subsidies. We'll also see guaranteed availability of insurance, which is really a good thing. This is one of the pillars that this law was made upon. And it says this, no matter how sick you are, we're gonna guarantee that you can find an insurance plan. That's a good thing, right? Because right now, if you have a cancer history or a pacemaker and you try to go buy insurance in the individual market, can you find a policy? No, you can't. You'll be declined. What the law did not say, however, is how much that guaranteed insurance policy would actually cost you. Let me give you an example. 2 years ago, in the summer, part of health reform kicked in for children, and it said children are guaranteed into a policy and cannot have pre-existing conditions on their policy either. So every single carrier in our state pulled out. They no longer wrote child-only policies. One brave carrier came back in the market and said, for a very small window of time, we're going to enroll these children only in the plan. Now, as an insurance agent, we expected to see about $100 a month for a rate for those children-only plans, which is fair. Problem is that if you had a child with, say, asthma on an inhaler or a nebulizer, that guaranteed insurance, instead of costing $100, now costing $700 per month. Same thing, same principles are going to happen. Because we are changing the entire way we perform health insurance and actuarial items inside insurance, we're flipping everything we know about health insurance upside down. I'm going to show you some examples. You'll also see employer requirements, the pay or play provision. That's what kind of the basic terminology is. This is where you pay the tax if you don't have the right kind of health insurance for your employees. And we're going to go over what those all look like. You also see essential health benefits. If you're a small employer, this is going to rock your world. No longer, as an entrepreneur of a small company, do you have the choice to offer anything except this. And I'm going to show you what those essential health benefits actually look like. We'll also see some wellness programs come down in 2014, although the rules are very slow to come. And I want to give you an example about the way rules are made. So we had a 2,700-page bill passed in March of 2010. But that bill left a lot of what-ifs and the secretary shalls in it, a lot of room to wiggle. So what they're doing is we're seeing these agencies create rules, CIO, IRS, Department of Labor, and so on, to clarify and answer your questions as employers. The wellness program is one of those things where I think we might see some stuff put on hold with them, and it's completely up to the regulators to do that. We've seen several items put on hold when it comes to health reform already, and I wouldn't be surprised if this one was on hold as well. So let's jump right in. Are you bored yet? Okay. Why is this going to cost more? I'm going to try very hard today not to be too insurance-y, so if I get too insurance-y, raise your hand and call me out on it, okay? There's a couple of very detailed items that I want to make sure to explain to you. There are more than 5 different new taxes that will be enacted in 2014. Some of them are already online today. I'm going to talk about 3 of them. I think the 3 most impactful. The first one is the reinsurance assessment. Now, you probably have heard about the reinsurance assessment, not with those words, but you heard about $63 per person. It's going to be on your bill. Did anyone hear that in the news, read it in the newspaper? It was all over the place in Austin. And so many employers said to me, oh my gosh, I pay $63 a person? Is it going to be a line item on my bill? Does it apply to large groups, small groups, self-funded? Who does it apply for? Where's that money going? How much are we going to raise? So technically what's going to happen is you're not going to see a $5.25 per month tax for each one of your insurance, but it's going to be rolled into your rate. This is going to be one reason why your health insurance will actually cost more in 2014. How much more? We're looking at $12 billion this year alone in 2014. The next year in 2015, it's $8 billion. And in 2016, it goes down to $5 billion. Now, this particular tax is supposed to phase out after 3 years. But my good friends in Washington, D.C. say once we start collecting a tax, we like to stop. I say you could change your ways, guys. You could stop collecting. The second kind of tax I'm talking about is the comparative effectiveness research fee. Now, this is a very interesting fee. Right now, it's $1 per person. In the future, it'll go up to $2 per person. And it works something like this. I'm going to use the room as an example. All right, so this, okay, number one, I'm the government in this example. Don't shoot me. I'm the government. We are all diabetics. Every single one of us in this room is a diabetic. We're all putting our $1 every year into the pot, or every year for every health plan in the pot. And we're putting all that money to do research on major illnesses in our country. So as a group of diabetics, we're very concerned about how the government is going to help us manage our diabetes. So this section of the room, you manage your diabetes with diet, exercise, and a pill. This section measures or manages your diabetes with diet, exercise, and an insulin injection. This side of the room, they need an insulin pump. So me and the wisdom of the government, and I've collected all these fees, so I've done all this research, say, here's what we think. We think as the government and with my team of doctors that diabetes is best managed with diet, exercise, a pill, and a shot. We do not, however, think diabetes is best managed by an insulin pump. We're also going to limit you to 4 test strips a day. So no matter who you are, you only get 4 test strips a day. Now, you insulin pump users, you can still purchase your pump if you'd like to do that out of your own pocket. But we think because we cover the vast majority of diabetics with diet, exercise, pills, and shots, this is going to be good for you. It doesn't just extend to diabetes. Think about every major illness out there. Colon cancer, cervical cancer, and most of the cancer, big cancer, breast cancer will be involved, asthma will be involved. So you'll see all these things being studied by the government, which is super fantastic. But what if you're the insulin pump user? Do you know how much it costs to buy a pump? About $5,000. I'm not far off with this either, guys, because look at Medicare right now. If you're on Medicare and you have an insulin pump, you don't buy it, you rent it. You're limited to 4 test strips a day. It's all they'll pay for. So the spirit of the law is this. Everybody gets covered, right? Every illness is covered. But at some point, not every treatment will be able to be covered. We've seen this in Canada. If you're 65 years old, you live in Canada, and you need a hip replacement, you're going to be put on a waiting list. You're not going to rush out to your orthopedist and have surgery next week. Very different. And you'll hear death panels, rationing. And I think some people who use those words are a little bit of an alarmist, but I do happen to think that there will be some limits put on our health treatment in the future. There has to be. We don't have enough money to keep sustaining a system that's going to cover every single American and legal U.S. resident. The third tax, and probably the most impactful tax for most of us, is called health insurance industry fee. It's going to raise about $8 billion in 2014, and it will likely be passed on to the consumers. All of these taxes will in fact be passed on somehow. I call this particular tax the Rob Peter to PayPal tax. Here's how it works. You've heard of the exchanges or navigator program or marketplace, right? The exchange is where everyone can go and try to find health insurance if you don't get it offered between a small employer, the individual market, or a large employer. So the exchange is going to come on board, and it's going to have hopefully several different carriers participating in it. So you'll see a Blue Cross, a Humana, an Aetna, a Guardian, a Cigna, whoever. Well, this particular tax says this. We don't want to make one of these insurance companies go out of business because maybe they own a very large percentage of market share in our state particularly. So if we all went to the best known carrier in your area, who would that be? Insurance company. Blue Cross Blue Shield. Blue Cross Blue Shield happens to own 60% market share in our state. What if we all went to Blue Cross Blue Shield? Remember, we're all diabetics and some of you need insulin pumps. What if we all went to Blue Cross Blue Shield? Nobody went to Aetna, Humana, Cigna. Right? So Blue Cross has to take all of us. And so what happens to claims? Up, 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 up. What happens to these other insurance carriers down here? They're still collecting premium. They didn't take on bad risk. What this particular fee does is it says this. You carriers are not taking on as much risk. We're going to need you to write Blue Cross a check. So it's all same. We all pay about the same amount. Let me give you a different example. Say I own a lumber company and I sell my 2x4s for $20 a piece. I have excellent marketing. I have a good location. I have great salespeople. And this gentleman over here also has a lumber yard, and he sells his lumber for $10 a piece. But he has a terrible location. Nobody knows who he is. And I'm selling my lumber like hotcakes. So he starts throwing a fit. He's not making any money. I'm making a ton of money. So in essence, I would have to write him a check. So his price and my price are about $15 each. So it's all about the same. So as an entrepreneur, does it really give you a competitive advantage anymore? No. Same thing's gonna happen here. There are other taxes and fees that we can talk about, but I'm gonna move on and start talking about some other things that will really apply to you. Any questions so far? We have had one great person start asking questions, always works nice. All right, so where do you fit in this big health reform fiasco? Where do you fit in? Currently in the state of Texas, our law says small employers are defined as 2 to 50 eligible employees. There is a law moving through, our bill, moving through the House and the Senate right now that would define small group in our state as 2 to 50 employees. So I think there's a very, very, very good chance that that definition is going to remain in place, 2 to 50. So for all intents and purposes today, I want you to put in your mind, if you're an employer between 2 and 50 full-time equivalents, which I haven't taught you about yet, that you are a small employer. Huge distinction between 4 different classes of insurance. You have individual coverage, which would be that my employer doesn't offer me any kind of health insurance. You have small employers between 2 and 50 lives. Then you have 51 all the way up, and then you have a separate self-funded class. So 4 different kind of things, but you figure out which one you are based on this information I'm going to share with you. So the size employer that health reform impacts is based on the total number of equivalent workers that you have. So you will generally hear things like, hang on just a second, I'm going to increase the volume. Can you guys hear me in the back better? Okay. So what you're going to see in the future is this. If you have more than 50 full-time equivalent workers, you're in one different pot of rules. Here's how I like to describe it. A hot sizzling frying pan for large employers and a hot sizzling frying pan for small employers. You just pick where you want to fry. Some of you are going to leave this seminar today and you're going to say, I'm firing 10 people, I'm going to be under 50 lives. I hear it all the time. Some of you are going to walk out here and say, you know what, I think she's right. I'm going to hire 4 more people out of 51 employees and see what those rates look like instead. For the first time, if you're on the cusp, if you're on the bubble of this 50 number, you have a lot of choices. So don't rush out and fire people until you have all the numbers. So here's how you figure out if you're large or you're small. You have to do a little bit of math, so whip out the pencil. I'm going to give you this example. It's in your packet. I have 25 full-time employees. Remember, full-time employees are defined by the federal government as 30 hours a week or more. Now, your definition may look a little different. Some employers have a definition that you have to work 40 hours a week to be full-time. Some of you do 20. For health insurance purposes, it is now 30 hours a week. You cannot change that. So I take all my full-timers working 30 hours a week or more. I have 25 of them in this example. Now, in addition, I have 40 part-time employees. These part-time employees work for me for 20 hours a week. Make sure you know exactly how many hours these part-timers work for you. So they work at 8 hours a month. In addition, I also have 35 seasonal employees, and those seasonal employees work for me 120 days or less. This is very important. Although in your packet I want you to put a little star by the seasonal employment, the rules are not final on seasonal employees yet. So if you have seasonal employees, lifeguards, maybe you're a grower in agriculture, think about how many days per week that your seasonal employees work, and put in your mind that you need to keep that under 120 days per year. All right, so now it's math time. 25 full-time employees, and I have to do 40 part-timers times 80 hours per month, which equals 3,200 hours, and then I divide that by 120. And that's going to give me a number. In this example, it's 26.6. That's your full-time equivalent status. So now you add your full-timers and your part-timers. You do not have to include any seasonal employees as long as they're under 120 days per year. And now I have the number 51.6. Am I large or am I small? I'm large. The magic number is 50. So this morning when you woke up with your 25 employees and you thought you were a small employer, hopefully you've done your math and you know exactly where you stand now. If you're unsure about the numbers your part-timers work, how are you going to get that information? Any idea? How about your payroll company? Your payroll company knows exactly how many hours your employees work, and know exactly how much they're paid, and know exactly how many pre-tax deductions are taken out. If you don't have a payroll company, maybe you do something internally on some software that you have in your office. I don't think any of you are still scratching out your math for your paychecks, but some of you might still be doing that. This would be a good time to introduce your staff or someone in your administration about payroll software and how to calculate that. First brave question, yes ma'am.
How do they treat people that are traveling? How do you add up their hours?
How do you pay them? Do you pay them per hour?
Salary?
So your salary, did you hire them in? Did you assume they were full-time when you hired them in?
Yes.
Then they're a full-time worker. You count them as one body.
How do you count their hours up in this formula?
If they're a full-time person or hired in as full-time, then they're just full-time. They count as one person. Yeah.
So when you're averaging out, like your part-time employees, when you're averaging out over the 80 hours of a month, it's over a month for the part-time people.
You actually don't average. You use exactly the number of hours that part-timer worked. So in my example, I'm working 20 hours a week, but I would take the exact amount of hours they worked per month and use that. Yes, ma'am?
They have to count temporary employees.
There's a lot of ifs, ands, or buts in this answer, okay? Not trying to be elusive. If they worked less than 90 days, no. If they're a variable hour employee, it means they didn't always work more than 30 hours a week. We have a different formula for that. I'm going to go over here in just a little while. If they're seasonal, no. There is not going to be a true definition of temporary employees anymore. They're going to eliminate some of that because of the 90-day wait. Yes, ma'am?
So what if your part-time people don't work the same each week? Is there a time period you have to do that and then average it?
Yes, we're going to go over that variable hour employees. There's a big formula for that. Yes, sir.
What about contract labor?
1099s.
1099.
We're going to talk about that too. You're going to hate me on that.
Employment agencies that provide temporary employees. Employment agency responsible for that, or does that count for
Depends on who owns the employee. Very tricky in those contracts. Many times, the temporary agency owns the employee. It's written into that contract, so they're responsible for everything. But there are some contracts where it puts you, the business owner, in ownership of that employee. So it just depends on how it's written. There's still a lot of wiggle room in that particular instance.
So that also leased employees.
Leased employees, yes, sir. Still on the fence with leased employees. All right, so in your mind, oh yes.
So at the very bottom line, in that formula, the 120 is the given in the formula. We weren't supposed to come up with that anywhere else.
No, that's the 120 is the divisor. So you always need to divide by 120 at the end. So does everybody know where they're at? You have a pretty good handle on if you're large or you're small at this point. Yes, ma'am.
What if you have no part-time employees, but smaller than 25 full-time?
Then you're a small employer.
Okay.
So raise your hand if you're small, less than 50. Raise your hand if you're large, more than 50. Oh, this is going to be so exciting. Very exciting. It's half and half. The battle of the employer. I love it. That means you're all going to have to pay a lot of attention. I'm sorry. All right, so let's jump into it. We're going to start with small employers. Hold on to your seat, small employers. I'm going to tell you exactly what you have to do. Remember, I'm the federal government that's giving you the best prescription of your health insurance in the future. Here's what your plans will look like. Well, number one, here's how they will be rated, okay? Remember, I'm going to try to not be insurance-y. I have to be insurance for just a second. Right now, we rate your small insurance group policies on your health and your SIC code. What do you do and how sick are you? Most of you have underwritten, if you're a small employer, you've underwritten in the past. You don't know that you've ever done it. But when the NCW people come to you every renewal cycle and they say, can you fill out this questionnaire as the employer? Or can your employees answer these questions on their employee application? That is underwriting. I want you to forget all of that. You're never going to have to do that again. Yay! Instead, you're going to be rated on something very, very different. There's only a few factors you have to remember. The first thing is coverage tier. Who do you cover? Employee, employee plus spouse, employee plus child, employee plus family. Super easy. You're going to know that pretty off the bat. Second thing is, where do you live? What is your specific zip code? Now, we think that the state of Texas will be divided anywhere between 5 and 7 regional rating zones. The more zones, the better. You want to stay out of the Houston pocket or the Houston region. They're very, very expensive for health insurance in Houston. Why? MD Anderson. Okay? So they charge more. They charge more today if you live in 770 as a zip code. So we want to divide our state up because you don't want the same rate as the Valley or El Paso or Austin. You want to have your own specific rate to your region. You have hospitals and doctors that work together, and we're going to set rates that way. Now, that on my part is speculation because the law actually says that you can have only one, you don't have to have more than one rating zone for our state. But as an advocate for you and health insurance in our state, I'm going to fight for as many zones as humanly possible. The second thing that they rate you on is your age. Now, if you're older, you're probably saying, oh, no. But I'm going to show you some examples of why it might be better to be over 50. If you're a small employer, I want you to put this in the back of your mind. In 2014, when you renewed your health plan, you could possibly have a different rate for every age person in your group. That means your 25-year-old has a rate, your 26-year-old, your 33, your 34, your 35, and on and on and on. Many carriers are going to rate like this. So administratively, I want you to start thinking about how in the world do I do that? Right? Because right now we have a composite rate. It doesn't matter if they're man, woman, smoker, non, overweight, or not. Here's your rate. So in the future, we could see some massive changes in that area. The next thing is, are you a tobacco user? Huge, huge issue when it comes to tobacco use. Here's the thing about tobacco use, it's actually self-reported. So Billy Bob's got a ring in the back pocket, he's spitting in a cup every day. He's going to tell you, I'm a non-smoker. Sally Sue's out in the smoke shack every hour on the hour, but she is not a smoker. Why would they say they're not a smoker? Because smokers can get charged 50% more in their insurance. 50% more. So would your employees say, oh yeah, I'm smoking it up? Let me give you the definition, the federal government's definition of a tobacco user. You use tobacco 4 times a week or more, you're a tobacco user. Anything less than that, you don't have to report it. So I don't know if that's 3 cigarettes a week, 3 dips a week, or 3 days a week. I don't know yet. In fact, we're not quite there yet when it comes to rulemaking authority. Now, if you use tobacco for a religious reason, you're exempt from the tobacco use. I suggested to my preacher that we start smoking. He's not like that at all. So I got to get insurance-y on you for just a second. This is called community rating, or adjusted community rating. Some states already have this methodology for rating. Texas does not. So what we do today in Texas for insurance rates is this. We take a beautiful, juicy pecan pie, and we divide that pie into 5 slices right now. So through premiums, each one of us pays 1/5, or we eat 1 slice of that pie every month with our premiums. Under community rating, we take that same delicious pecan pie and we divide it into 3 slices. That means each one of us eats 1/3 of the pie to make it more fair for everyone involved. Now, for the first time in your lifetime, what you're going to see is this. You're going to see a complete shift in the way health insurance premiums are charged. In 2014, with community rating, you're going to see the insurance premiums strapped to the backs of our youngest generation. So if you're between 21 and 40 years old, you are going to eat more pie than you have ever eaten in your life. If you're over 40, so really the sweet spot is 50 to 64, you're going to see your premiums come down. So if you're over 50, you're pretty excited right now, right? There's a couple of problems I have with this concept though, just as an insurance person. When do you start using health insurance generally? Yeah, when I turned 40, everything started to hurt, okay? I was ready to go to the doctor and get me on prescription drugs. Do our younger generations, do our younger folks go to the doctor as much? Can they afford health insurance? When you were 25 years old, were you rushing out to buy a health plan? Or were you looking for a bass boat or six-pack? When I was 25 years old, I was looking for the six-pack, to be honest with you. I didn't have the money when I first started to buy health insurance, nor do I find it very valuable. I don't think that answer has changed. I don't think if you asked a single 25-year-old walking down the street or on this campus right now, do you want to pay $130 a month for your health insurance? They would say, why? That's my car payment. Why would I do that? I never get sick. So the first time, what you're going to see is you're going to see 50-year-olds and older, you're going to see a slight premium decrease, right? Because they've always paid more. They're higher utilizers, they take more drugs, they have more expensive hip replacements than the younger generation does. So we're going to see their premiums come down. And in return, we're going to see the younger generation's premiums kind of come up. So we're all eating 1/3 piece of the pie at that point. Any questions about that? Yes, sir.
It's not about that, but where do your previous health plans come in?
They don't matter at all. So if you're a small employer under 50, and you were doing House Bill 2015 data every year to try to figure out what your claims look like and what the projections for the next year should be, it doesn't matter. It doesn't matter at all. Yes, sir.
Are you saying that we are required to charge different rates for employees that smoke, different ages, or that's determined their overall plan?
Some carriers will roll in the rates, and some carriers will charge smokers and tobacco users a 50% increase.
But the employer's not required to charge individual employees more or less?
I don't think you're required to do that, no. So you can still have a steady percentage across the board. So if you're a small employer, 2 to 50 full-time equivalents, you have no choice. This is community rating, it's coming to you. Yes, sir.
On the tobacco surcharge, that would be something that would be allowable for an employee to work into the rate for tobacco.
Yes, sir, that's correct. Now, the wellness programs I talked about in the timeline, it's supposed to offset that 50%. Because if you install a wellness program in, and it has smoking cessation in it, those people who are actually being charged 50% more in their premiums can actually see that neutralized if they participate in a smoking cessation program. All right, so in addition to being community rated small employers, you will also have to carry what's called essential health benefits. I call these the Big Ten. These benefits do not scare me at all. I don't find anything offensive about ambulance, maternity, prescription, rehab, mental health. I love them all. There's a couple of things about essential health benefits that I don't like. Number one, look at number 10 on your list. It's called pediatric dental and vision. This particular caveat in essential health benefits will force every single small employer in our state who is not grandfathered to renew their health plan in 2014. That one alone makes you have to redo your entire health plan, because you must offer these things. So if you're a group of 50-year-old men, engineers, let's just say, you now have maternity coverage on your plan, and you also have pediatric dental and vision. You can't take it off. If you're an individual health plan, so your employer doesn't offer health insurance, and you're a 60-year-old woman with a hysterectomy, you now have maternity and pediatric dental and vision. You cannot take it off. That means all of us who work for employers between 2 and 50 or have individual plans now have about the same level of benefits. The other thing I don't particularly like about essential health benefits is this: there's no limit on them. So if it's on the list, you can't limit it. Most of you small employers right now have a limit on, let's say, mental health, or let's say substance abuse. Most of you have either a $10,000 or $25,000 limit on substance abuse, inpatient substance abuse. The average cost and office for a substance abuse in treatment facility is $1,000 a day. So you go through 30 days, that's 30 grand. You pretty much exhausted all your benefits in today's world. But after you renew your health plan in 2014, that never stops. So as much mental health or as much substance abuse as you need, you're now going to receive. The other thing about essential health benefits for you small employers, and I want to make sure to point out, is this. The federal government has given us a guideline of deductibles and maximum out-of-pockets. Let me first touch on the deductible. Anybody have higher than a $2,000 deductible right now? Right. The first law of insurance, Insurance 101, whether you're buying car, house, or home, or body, is prices get too high, you raise the deductible. My kid turned 16, I had to buy a car, I got 2 cars. So what do? I increase my deductible on both cars to $1,000, and the next day we have a hailstorm, right? Just the way it works. Insurance is the same way for health insurance. What happens is the prices go up, we say, let's raise our deductible, right? More cost sharing for our employees. Government says, no sir. The highest deductible you can carry in 2014 will be $2,000 for a single, $4,000 for a family, period. Now you could go lower if you'd like to go lower, but you may not go higher. Now the first year that you renew your health plan, I bet you're gonna see some wiggle room on that deductible. You might see $3,000, $3,500 for some companies are really pushing the envelope. But the law says $2,000 single, $4,000 family. Now, I know you know how insurance works, but I'm gonna give you a super quick, fast refresher. Say you have a $100,000 claim. You pay your deductible first, in this case we're gonna say $2,000, and then you pay your co-insurance, which most of you probably have an 80 or 90% co-insurance, right? So that means that your claim, you pay 20% of your claim, or 10% of your claim, all in network we're talking. But you don't want that 10% of your co-insurance to last forever. You want that to stop at some point. We call that a maximum out-of-pocket. MOOP is what some people call it. I call it a backstop. So your backstop stops under new health reform guidelines at $6,350 for a single, $12,700 for a family. So if your family had a ton of health concerns one year, you're really seeing a doctor, you had a $100,000 claim, for instance, the most you'll ever pay out of your pocket, including prescription co-payments, doctor office co-payments, emergency room co-payments, all now go in one big bucket, and they stop at $6,350 for a single, $12,700 for a family. That is very different than what we do today. Today, you go to the doctor 50 times, you pay your co-payment 50 times. It never applies to your maximum out of pocket. You have 50 prescriptions, you pay that prescription drug co-payment 50 times, never applies to your maximum out of pocket. That changes when you renew your health plan in 2014. In addition, preventive care will also come on board and be covered at 100%. Now, some of you are already enjoying that preventive care covered at 100%. This is a very good thing. I love preventive care. I very much believe in it. Raise your hand if you've had a colonoscopy. Come on, be proud. Thank you. My sister's 46 years old, stage 2 colon cancer right now. Colonoscopy saved lives. But those of you who raised your hand, who were brave enough to raise your hand and said, yes, I have had a colonoscopy, this particular scenario happened to you. You drank your half-gallon of goo, you went into the doctor, you got real sleepy, and they never collected a check from you. No deductible, no co-insurance, no co-payment. But when you woke up, they said, oh, we're so glad you came in because we found a polyp. Guess what? This is no longer preventive care. You were sick. So now we need you to open up your checkbook. We need deductible co-insurance or co-payment or some kind. That happen to anyone? It happens all the time. The federal government, through rule-making authority, remember how I said we have the law, but now we have the rules. One of the brand new rules that came out very recently, less than a month, says you go to sleep and it's a preventive service, you wake up and they took out a polyp, it's still considered preventive service. So now there is no cost sharing on colonoscopy if you qualify under preventive care. So those of you who are waiting to have your colonoscopy or putting it off, don't put it off. It's not going to cost you anything. But for the next 2 to 3 months, I want to make sure that you call your provider and say, I know that the rules have changed on colonoscopy. Is your system up to date? Am I going to have any out-of-pocket costs? cost sharing for this. Some of them aren't ready, some of them are still charging, but they're not quite online yet. In addition, you're gonna see no lifetime limits. Yes, ma'am?
Does that apply to all wellness exams?
As long as you qualify under the federal guidelines for the wellness exam that you are going in to receive, then yes, that's true.
What if they found cancer when they did your colonoscopy?
As long as it's preventive care, so you're over 50, it's okay. It's still not, no cost sharing. True. But if you're a 30-year-old woman, you're gonna go in for a mammogram and you think that's preventive care, that's not preventive care. The government doesn't think that's preventive. So if you look at lifetime limits, the Christopher Reeves of the world, where his insurance stopped paying at about $3 million, that will never happen to you. Your insurance keeps going and keeps paying because there's no lifetime max for these plans anymore.
Is that the same for big and small, both rules?
Some of them do apply to large employers and some of them do not. The preventive care does and lifetime limits do apply to large and small. The maximum out of pocket is $63.50 and $12,700 also apply to large employers, outside of employers, and individual plans. That particular law goes across all four. So what's this going to cost? Small employers, 2 to 50 eligible employees, boiling it all the way down in just in Texas very specifically. In 2013, we expect to see a 30% rate increase. That's this year. When you open your renewal, the average renewal price in Texas is 30%. My health plan renews May 1st, we get a 28% rate increase. I study these numbers pretty carefully just to make sure that we're kind of on the bubble, and I think that for the most part, this is pretty true. You live in a Houston or Dallas, the rates might be skewed a little bit. In 2014, because remember in 2014, when your health plan renews, you completely switch the way you do health insurance. You don't underwrite anymore. You're only looking at tobacco use, where do you live, and what's your age. We expect to see premiums increase 30 to 50% in 2014. So your younger, healthier groups, the groups that we have been telling you for years, hire healthy males, they're going to kill you in 2014. Because what happens is they've been down here with their rates. Now we're going to have to equalize everyone out. If you're a max-rated group with an older population, you're going to see, not as hard, you're going to see like a 30%-ish rate increase in 2014. So I keep saying to you, when your health plan renews in 2014, as a small employer, 20 to 50 eligible lives, health reform kicks in for you when you renew your health plan in 2014, not January 1st, 2014. So the ones of you in the first quarter, January, February, March, who just renewed your health plan, you're the guinea pigs for health reform in 2014. You're going to go first. Second quarter, some of the stuff might be ironed out then. Some strategies that people are developing today, including some health insurance carriers, 2 major carriers and a third on the way, is saying, small employers, we know that if you were to move your effective date or your start date to later on in the year, we can get you out of some health reform into 2014. So some carriers are coming to you with strategies saying, here's what your renewal will cost now. We'll renew you again in December, and that gets you out of health reform for 11 months. Right? So you have today's prices, today's benefits, today's everything, and skirts Obamacare for 11 months. Yes, ma'am.
So at my company, we renew insurance December 1. So we wouldn't have to reform until December 1 or 2014.
Absolutely right. The later your effective date, the better it is, in theory. Yes, sir.
The largest employers too.
No. There are, I'm going to really ruin your day if you're a large employer in just a second, but large employers have a different set of rules to play by. Now, moving your effective date to the fourth quarter of 2013 will not benefit all of you small employers. You will need to do a lot of homework. Actually, the brokers are going to have to do a lot of homework for you if you want to look at the strategy. Because it means quoting today, or quoting your renewal, and then looking in December and see what those rates will be like. It also means for some of you, you're going to take 2 hits in 1 year. You're going to take 1 hit on your renewal, and trust me, you're probably not going to get a rate decrease. Remember all the taxes talked about earlier, they're phasing those in right now. There's also something, and this is going to be offensive to some of you people, I call it a pucker factor. Insurance companies are puckered up right now. They have no idea how much it's going to cost. They have no idea who's going to enroll, who's not going to enroll, which scares them equally as much. So they are preparing for the absolute worst. How do they do that? By collecting premiums, right? So be prepared for some kind of rating change in 2013 and 2014. Small groups, any questions so far? So remember, if you are under 50 full-time equivalents, you are not taxed, fined, or penalized if you do not offer health insurance in 2014. Let me ask you a question. Raise your hand if you must, by law, give your employees health insurance today. Nobody, right? Not one of you has to offer health insurance today. But you do it for a reason. Why are you doing it? Anybody? Benefit your employees. Retain employees. Hire good employees, right? Some of you are very specialized and you have got to search for those employees high and low to get them to come work for you. Do those reasons change after 2014? No. Who's going to work for you if you don't offer health benefits? I don't know. Are they going to be the best and brightest? Who knows? I always tell my boss two things. I say, you stop offering health insurance, you stop giving me a parking spot because I'm downtown right by the Capitol, I'm out of here. Okay? Your employees are going to start saying the same things to you. You want to make sure that you are actually having a benefit that's of value to them. Remember that I don't want you to go home and fire people right off the bat, and I also don't want you to go home and give someone a huge raise. In the beginning, when health reform first came out, a lot of people said, oh, I want no part of this. I don't want the government to tell me what to do. I'm just going to give my employees a raise and tell me to go get health insurance on their own. Well, what happens is, number one, they don't buy health insurance, they buy a bass boat. And number two is that you as the employer are paying more in taxes, and so are they. And you can potentially block them out of receiving a subsidy from the marketplace because you pay them too much. So there are a lot of repercussions about just giving someone a raise. The other thing I want to tell you is that the folks at NCW, even you small employers, especially small employers, they're going to bring you options at renewal. They're going to come talk to you, and you're going to have to carve out some time to talk back to them. This is going to be a consultation. It's no more of, here's a bunch of spreadsheets, options, just pick one. It's not like that anymore. You're going to get self-funded options, which might scare the heck out of you, but it's very important to know that if you're self-funded, you get out of about 90% of health reform, including community rating and essential health benefits. So the 30 to 50% rate increase I just talked about would not apply to you if you were self-funded. For some of you, self-funded is scary because you heard about some guy at your church who had a premature baby and he lost his business and it was too much. Those are not the same products that you're going to see in 2014. Now, I wouldn't self-fund until you renew it in 2014. But it's going to be an option for you. And it's going to be with major carriers that you already know, love, and trust. But sometimes they work 32, 36, 38. They're still full-time employees, but it doesn't always have to meet that 40-hour-a-week definition. Then you have your problem children. They're called variable hour employees. Variable hour employees impact people that have employees who 1 week work 20 hours a week, next work it's 10, then it's 40, then it's 50, then it's 60, 52, all over the board. If you're a restaurant, if you're a PRN, if you're a staffing agency, if you're a construction agency, anyone who doesn't have a core group of serious full-time employees could possibly have a variable hour employee. Anybody have any? Oh, you guys are going to love this. Okay. There's a very simple way to determine when you offer health insurance to your employees. Number one, for all of you, small, large, and self-funded, you cannot make your employee wait any longer than 90 days to get on the health plan. Let me repeat that. It is not first of the month following 90 days. It is a solid 90-day wait. Now you can do first of the month following 30, first of the month following 60, 82 days, 64 days, you can do anything less than 90. You must offer all full-time employees coverage no later than the 90th day. Even if the 90th day is a Saturday, Sunday, or a holiday, gotta make sure they're enrolled by then. This is one of the provisions I would change on your renewal this year. Yes, ma'am?
That's effective when?
It's effective on your renewal date in 2014. But it's one of the things that if you're a large employer, I highly recommend you start on your renewal in this year. I'm going to tell you why in just a minute. So this is a particular change I would make in 2013 if you're a large employer. If you're a small employer, you can wait until your renewal date in 2014. Don't try to get cute either, by the way, and say they're temporary for 6 months. You can't do that. Everyone's going to come in and they're going to say no. You had a longer than 90-day waiting period, we're going to start the penalty back when you call them a temporary employee instead. If they're seasonals, less than 120 days, you're going to be okay. But make sure they're deemed as seasonal employees and you fire them on day 119. So the government has given us a 3-step process in order to recognize and determine when our variable hour employees need to be covered. Very simple 3-point plan here. The first thing is you have to measure their hours. Now, I will tell you that if you're a large employer, I want you to start measuring as of January 1st of 2013. Yes, that's right, that was 4 months ago. Who knows your employees' hours? Your payroll companies. They can run a report for you with every one of your employees' names, the amount of hours they worked. Now, this might be a little overkill for some of you, but for others of you, it may be very valuable information to have. If you are carving out employees today, that means you only offer insurance to a certain population, could be directors, managers, salaries, not hourly employees, not the people in the field. You are discriminating in your health plan, and that will no longer be allowed. In addition to that, if you don't have every person that's eligible on your health plan, large employers, that's eligible for coverage, enrolled on January 1st of 2014, your penalties start that day. So if you're carving out today, and you think you're going to wait until your renewal date in 2014 to offer health insurance to everyone, your penalties start January 1st of 2014. Yes, sir.
Does that qualify as an open enrollment event? Could you wait until right up into it and then open it up for open enrollment?
That was an excellent question. That wasn't planned or anything, was it? So, insurance-y language here. Open enrollment means that's the one time of the year that your employees get to come on the health plan. There is no special open enrollment from any carrier on January 1st. So that means if you renew your health plan on July 1st, let's say this July, you're a large employer, you carve out. You better get every single eligible employee on your health plan in July, because they're not eligible to come onto your health plan until July of 2014. But if those people that got carved out actually went to the marketplace or exchange to purchase health insurance, they received a subsidy, that starts January 1st. That means you, Mr. Employer, are now paying the penalty January, February, March, April, May, June, July, 7 months. And they'll prorate it for you, don't worry, no big deal. So if you're carved out, you need to set an appointment with the NCW team to help you with strategies in order to avoid those penalties. Very big deal. So back to your, oh, yes, sir.
I just want to ask you about Medicare, how that fits into the system.
No major change for Medicare.
Now, what, if you have employees that are on Medicare, do you have to also have a policy for them?
No, same rules apply today with Medicare, so nothing changed.
Medicare is a qualified plan.
Medicare is a qualified plan, TRICARE is a qualified plan, Medicaid is a qualified health plan. Yes.
So if someone is qualified and on Medicare, we do not have to put them on our plan?
No.
Or on our phone?
No.
Now, does that person count as, your employee count?
Yes, you would still count them because they're a W-2 to determine if you're large or small. Yes. Yes, ma'am.
So if you have employees that their spouse covers them full-time, that would be a qualified health plan also.
Okay, so that's tricky. It's very tricky because in the future, dependents are not defined as a spouse. So dependents under health reform are only children. So large employers don't have to cover spouses anymore. They don't even have to offer spouses coverage. So if you're married and your husband's plan covers a spouse, and you take that coverage, as long as it's qualified, yes, it will be a qualified health plan. You can waive out of your coverage. But what if your health plan starts January 1st and your husband starts July 1st, and they stop offering dependent or spousal coverage in July? Then how do you get on that plan? I mean, that's a qualified event at that point, but it's one of those things that's a little trickier than it is today.
How do you cover yourself for those employees that are covered by their spouse's insurance?
How do you cover them?
How do you cover yourself paperwork wise? Because our receptionist is covered under her husband.
Yes.
How do I mean, I don't have to offer, she's declined it.
No, you have to offer her
I
health
did,
insurance.
and she declined it, and that's all I need to do?
Right. You make sure that you can, and I'm very conservative when I come to this, so your broker team might say you don't need to do this, but I recommend a wet signature. I mean, you took the time, and I would even go so far as to make sure that there's an acknowledgement box they have to check, and they sign with the date. That'll keep you out of trouble. Yes, sir.
Can't you get a letter of credible coverage from?
I don't think you can do that by law. I don't see anything in the law that says you can require a declined employee to provide some kind of proof that they have insurance somewhere else. I don't see that in the law. Doesn't mean you can't do it, just, I don't see that.
Back to the Medicare question, for large employees, or large employers, you can't force an employee to go to Medicare.
No. You can never force a Medicaid recipient or Medicare recipient on where they should go. Now, you can suggest to them very gently, but you can't make them do anything. Did he make you? Man in the back.
Regarding the question that you asked earlier, so the employee defines your insurance, but using the previous example, then their insurance, then, I don't know, their husband is fired and they no longer have insurance, what is our responsibility to them at that point?
So getting fired is a qualified event. So think about your COBRA qualifying events, birth, death, divorce, loss of coverage. Getting fired is a triggering event, so they come back to you and they say, I lost my coverage, I need to enroll, and that can happen off cycle. That's completely allowed.
But they only have 30 days, right?
Correct, they only have 30 days to do it. Yes, ma'am.
Just to clarify, if the spouse is providing the insurance, we should have some type of the letter that our employee is on saying, no, thank you, I have insurance for my spouse.
Absolutely, absolutely. In writing. That will keep you out of some trouble, I think, with penalties. Yes, sir.
Just a question about Medicaid. We have a lot of part-time employees that don't have insurance, and they don't want it because they just have state insurance or Medicaid. Is that considered a qualified plan under the new rules? So
Yes.
they elect not to take new coverage, they can just keep doing what they do.
True. Now, one of the things I forgot to point out for, remember when, in the very beginning, when we did the calculation of my large or my small, we had to do that 120 divided by 120, and then use the part-timers in there? I forgot to tell you, I apologize, but you never get penalized on part-time employees. You never offer them health insurance, you're not taxed by or penalized for not offering them health insurance either. So in my example, I'm a large employer, but I only had to offer health insurance to the 25 full-timers. So some of you will develop a strategy internally that says, I only have part-time employees, and that keeps me out of the tax fine or penalty, and it also keeps me away from offering them health insurance. That is completely legal. Part-timers only counted at one time, if you're large or small. All right, so I'm gonna jump into variable hour employees. Do you guys need a break? You okay? All right. Variable hour employees, 3-step process. Here's how you do it. First step is you as the employer, you take any kind of measurement period between 3 months and 12 months. Pick one and stick to it. In my example, I'm going to give you, I renew my health plan January 1st. I'm a construction company. I do a lot of business all year long, except October, November, December. I don't have a lot of employees those 3 months, so I'm going to choose a 3-month measurement period, or look-back period, is what some people are calling it. That means I'm going to measure the hours my employees worked in that period that I've selected. Remember, no fewer than 3 months, no more than 12 months. So when I told you start tracking your employees' hours as of January 1st, 2013, some of you will actually use a 12-month measurement period. But you got to know how many hours your variable hour employees are working. Now, if everyone in your company is full-time, or everyone in your company is part-time, you don't really need to spend too much time worrying about this. So now you've measured their hours, and over your measurement period, remember mine's 3 months. I'm sorry, go ahead.
Do you get to just choose? Like,
Just pick it.
I'm gonna say 4 months. Like,
Sure.
you can pick.
You better stick with it. Pick it and stick it. Yep.
And then you said, I'm gonna pick June to September, like, every year, or?
So you look at your renewal date, your start date, and you count backwards anywhere between 3 months and 12 months. That's your measurement period.
Thank you, I'm sorry.
No worries. It's more fun when you yell. It's exciting. We've measured our employees. We know exactly who works more than 30 hours a week.
You were doing that from the renewal date.
From the renewal date, yes. Then you have to administer the plan to them, provide the plan to them. How long can you make them wait? How many days? 90, yes. You can actually enroll them anytime between 30 and 90 days. Pick it and stick it. Pick the number and stick to it. Do not discriminate and say, oh, directors get 30 days, hourlies get 90 days. Don't do that. We've measured them. Now we've enrolled them in the plan. I'm going to use 60 days to enroll because I'm kind of slow. All right, so I got to make sure they have their SBC in hand. I got to make sure they have payroll deductions. I got to make sure they're enrolled. They filled out all the paperwork correctly. I got to make sure that I send it in on time. I really like them to have an ID card in their hand. I'm going to do an open enrollment. So I'm going to use 60 days to determine that. The last period is called the stability period, or how long do I have to keep them covered? Here's another rule. It is the longer of 6 months for your measurement period. So my measurement period was 3 months, right? How long does my worker have to be covered on my health plan? 6 months. If your measurement period is 12 months, how long do you have to keep them covered? 12 months. Even if they fall below 30 hours a week, they're still covered under your health plan. Questions about this? You need to hear this about 500 times and then you're going to get it. Repeat the whole story?
Repeat, please.
Okay. Measure the hours that somebody works, the variable hours that somebody works. Measure all their hours, and you're going to determine what you divide that by, basically. Is it 3, 4, anywhere between 3 months and 12 months? Pick a number and stick to it. So you're going to say you're going to pick 6 months. You're going to measure the hours that your people work for you for 6 months. You're going to take the actual number of hours and you're going to divide that by 6, because that's your measurement period. Then you have to enroll them in your health plan. You have anywhere between 30 and 90 days to enroll them in the health plan, but not longer than 90 days. So you enroll them in your health plan during the administrative period. And you have to keep them covered for a certain amount of time. The longer of 6 months or your measurement period, regardless of the amount of hours they work for you. Yes, ma'am?
That includes they get fired.
If they get fired, they are no longer your employee. If they get fired or they leave your employment during the stability period, you offer them COBRA or state continuation, and then they're on their way. Small employers, I'm going to give you a little preview of what's going to happen to you later on this year. Small employers When you terminate someone or they quit, you offer them 9 months of state continuation, right? Right? They leave your employment, they want more health insurance from you, you have to cover them for 9 months. After September of this year, the state of Texas has put in a sunset in that particular vision, that 9-month state continuation rule. It reverts back to 6 months. So be looking for information from your carriers and your broker team, because they'll help you through this transition, probably October or November-ish later on this year. Just one more thing for you to do in your health insurance plan. Questions about variable hour employees and how you measure them. Yes, ma'am, sorry.
Is it hours worked or is it hours that they would pay for?
Excellent question. Hours are paid for. Vacation, sick, bereavement, jury duty. You pay them for an hour, that you count that as an hour worked. You guys are good. That's a great question.
Overtime?
Overtime counts. Oh, yeah.
What
Yes,
about call time?
call time, on-call time? A little more tricky. So do you pay them for on-call time?
At a reduced rate?
Then yes, it's an hour worked. Somebody gave me an example of they're on call, they don't pay for them to be on call. And I couldn't find any reference to that in any of the rulemaking authority. It really is hours worked, and compensated hours worked. So it is. Yes, ma'am.
So with that, as the on-call, if we provide them a communication cell phone, they're not necessarily paid for those hours unless they get a call. Would those hours that they have that company cell phone for that weekend or for those days?
It's about the hours compensated.
So if they're,
Yeah. Again, and this rule could change, because I don't see any rules that address something like you're talking about, where technically I'm on call, but I'm not getting paid for it. I don't see anything that would address that particular situation. It's only hours compensated, basically. But did you hire them in as a full-time employee?
with instructions.
Yeah.
It just depends, what's going on.
Yeah. Yes, ma'am.
So our employee is on call overnight, 13 hours, and she gets called out to go pick up something, and we pay her, she gets $1.50 an hour for on-call and $1 regular pay for going out and doing something. So, but we count the 13 hours of on-call as an hour of work.
You counted as 13 hours of work.
13 hours.
You compensated her for 13 hours. Yes, sir.
What about whenever an employee is compensated in a specific amount, regardless of their on-call hours? So they were given $500 extra on a week that they're on call, rotating. So what do they do? And they may or may not work any hours at all. So how does that count into it?
I don't know. I don't know how if you just bonus someone $500 for the weekend for being on call, and you don't tie that to an hourly wage work, do you say that they actually work for 48 hours over a weekend?
They work during the week, and then when they're on call during the week, course of the week, they may or may not get called out, but they get essentially a stipend amount for that service. And if they get called, they do.
It's one of the things that I don't have a rule to give you a solid answer on that. Questions up here? Yes, sir.
So if you have 60 full-time employees, can you go, and let's say I've got a lot of farm laborers, can I now go to and hire 120 part-time employees
Absolutely.
and get away from?
You didn't get away from it. You'll probably be still a large employer. But remember, you only have to offer insurance to full-time employees. Let me give you an example. I'm consulting with a group, a gentleman right now owns a janitorial company, 12 different states, 850 bodies work for him, 850 payroll checks he cuts a week. Once I was done with him, he had 30 full-time employees and the rest are all part-time employees. And he added another 400 bodies to his payroll. So now he issues over 1,200 paychecks a week, but he only has 30 full-time employees. This is a strategy that will work for some of you, definitely. Sounds like maybe it could work for your company. But remember, because we don't offer health insurance to part-time employees, one way to do that is to make your employees work less than 30 hours a week. So if you're construction, farming, retail, restaurants, PRN nurses, home health, that could be a strategy that could possibly work. Now, it's not as clear as it's just $1 here, $1 there. There's a cost to hiring, training, and firing your employees. So you need to make sure to add that in. You get out of health reform in one instance, but now you put the money somewhere else to hire all these part-time employees and to train them. Yes, ma'am.
In the measurement period, we keep our part-time employees, we're trying this year to keep them at 28. During the measurement period, how many times can a part-timer hit 31 before they're qualified? Is it one time?
Yeah. It's not one time. Remember, it's an average over your measurement period.
Okay, so you're going to average.
Absolutely. Yeah. So don't be afraid if they go over that 30-hour week mark once or twice or 5 times. As long as the average is. That's why the next week you're only working 21. Yep. All right, we're moving on. So what about 1099s? A lot of you entrepreneurs were really super smart when you heard this law and you said, forget it, they're not W-2s, they're 1099. I'm out of this. Let me give you an example of 1099. Say I say, sir, I'd like you to come build a fence for me. I want it done by August 1st, I'm going to pay you $5,000 to build me a fence. That's one kind of employee. Or I say to you, sir, I want you to come build me a fence, I'm going to pay you $5,000, I want it done by August the 1st. I want you to use all my very expensive lumber, all the tools, all the special oils I bought and provided for you, my electricity, and by the way, you can only work from 10 to 2 because I like to sleep inland. Who is the 1099 in that example? The person, right? Because I didn't give him a tool in the first example. The moment you give an employee a tool, for the very most elementary definition of a 1099, they're no longer a 1099 employee. Think about what a tool is in your business. Is it a computer? Is it a cell phone? Is it a truck? What is it in your business? So make sure that if you have 1099 employees, they are in fact truly 1099 employees. And don't take my word for it. I want you to make an appointment with your CPA. And I want you to ask them 2 different questions. I want you to ask them, number one, do I truly meet the definition of 1099 for my employees? Here's what they do, here's when they work, here's the tools I provide them. Are they truly 1099s? Second question I want you to ask your CPA is this. Commonly owned companies are now going to be faced under one umbrella depending on the percentage of ownership. This is very complex. Let me give you some examples. Let's say you own 10 restaurants, and in 5 of them, you own 51% ownership in the 5 and 25% in the other 5. Under health reform law, you take the 5 that you own 51% or more of, and you put them into one giant employer account. You take all your employees from those 5 companies, and then you determine if you're large or small. So when your brokers ask you on renewal, what else do you own and how much of it do you own, they're trying to keep you out of trouble. Many of you have maybe a spouse that has a company and you have a company. Say I was married and my husband ran a record service with 26 employees and I owned a nail shop with 25 employees. Because of common ownership, we put all those employees in one pot. Now we are a large employer. Someone usually says about right now, well, I'll just divorce him. Obviously, I traumatized you this far in the presentation where you're not thinking any of this is funny. So 2 questions for your CPA. Are my 1099s truly 1099? And if I own more than one company, what percentage of ownership do I own in that company? Yes, ma'am.
What if your partners are 50-50? Did each of them have to claim those employees? Or did they split the claiming of those employees?
There's an assumption at 50% that there is no common ownership at 50%. But the burden is on you, the owner, to prove that. So this is a CPA question. And if your CPA says to you, I'm going to use the 401k rules to determine common ownership, I want you to call another CPA. Because that does not apply to health reform. Rules are different. Question back there. Yes, sir.
So if you have a company 3 different LLCs, but they all, one owns the property, one manages it, and so on. Can you split your employees up in those 3 different LLCs?
Nope. Do you own more than 51% of each one of the LLCs?
What if you got 4 brothers and you want to give one brother this LLC, the other brother this LLC, and your dad this LLC?
As long as there's no more than 51% of any one company, then they can be split up. But there is a brother-sister rule that you need to ask your CPA about. Because if you have 4 companies and each one of you owns 100% as a family unit, there are some caveats in the law that would possibly prevent that from happening. So it's a very high level. It's not just as easy as I'm making it sound with 51%. You have to walk through several different steps. There's like 7 different categories. The brother, sister, husband and wife are 2. But there are lots more. Other questions? All right, so large employers, I'm getting on you again. You must do 2 things in order to stay out of the penalty box with health reform. Number 1 is you must offer a qualified health plan. Now, what you're going to hear in the future are things like silver, bronze, gold, and platinum. I don't like to use those terms because I feel like I got assimilated by the government when I do that. So I say 60%, 70%, 80%, 90%. What you will offer as your base plan is a 60% minimum value to your employees. Remember earlier someone asked the question, well, can I have several different employee options? This is where it's going to come into play. You're going to offer a base plan somewhere around a $2,000 deductible with a max amount of pocket of $6,350 and a 60% minimum value. There are certain benefits that you must cover. Those rules are not 100% published yet, but I kind of have an outline of them. They don't look exactly like essential health benefits for you large guys. It's going to be less expensive. So you must offer a 60% minimum value plan. That's number 1. That's going to be very easy to do. You are probably far exceeding that requirement today. The second part is not so easy to achieve. It's going to require some math and some tracking. It's called the affordability factor. And affordability, under the federal guidelines, have 3 safe harbors. When the bill first passed, it said 9.5% of the household income. Do not listen to that, it has changed. The 3 safe harbors are in your packet. They're completely legal for you to determine affordability in your health plan. I particularly favor 9.5% of the Box 1 W-2. I think that this is the safest method for you to make sure that that is affordable for your employees. However, it creates an administrative nightmare for you. So what it essentially means is that every pay period, you would make sure that you are not charging your employees more than 9.5% of the Box 1 W-2 income. So if you bonus, raise, give commission, that number can change throughout each pay cycle. Some people, some of my coworkers actually believe that the best safe harbor to use is the last one, and that's based on federal poverty level. Right now it's $11,170, which translates into your employee's paycheck of $88.43 per month. So let's look at it from an employer perspective. If I chose to give my employees health insurance as a large employer, and it's minimum 60%, I can charge them $88.43 a month for their coverage. And I can do it for the guy making $750 an hour, all the way up to the guy making $250,000 a year. It would be the same across the board, $88.43. Or I could take those same numbers and apply it to each person in my company. So the guy making $750 an hour pays about $130 a month. The guy making $100,000 a year, he pays $9,500 a year, right? Those numbers are going to be very different. Now notice I never said this 9.5% is tied to the premium. Right now we do it by premium, right? Right now we say 50% of employee only, that's what I'm going to pay as the employer. Is that how most of you do it? A percentage, right? That's not good enough in the future. In the future, you use one of these safe harbors to determine affordability for each one of your employees. Now, who knows how much, and their employees make, their box one or after pre-tax deductions on their W-2 every single pay period. Payroll companies, payroll software. It's not as hard as it seems. It can be adjusted. If you are a small employer, there is no affordability factor. If you're a large employer, this is where many of you will get tripped up. Many of you will mess up and charge someone 10% of their premium, of their W-2 income. So make sure you're utilizing every piece of technology, including the payroll companies, to help you move through this process.
So this does not apply to small business?
Not apply to small employers. Yes, sir, excuse me.
Do you use a variable rate on each paycheck?
Yeah, you could have to do this. If you use box one W-2, like I recommend, you can have to change their deduction every single pay period.
So you could just say 9.5%, whatever their taxable wages are.
You could say that every single pay period, yes. And some of you will use a very easy $88.43 a month factor. It just depends on how you want to run it for your company. So let me ask you this. If the premiums are $800 a month, are you only going to collect $88.43, or are you going to make them pay up to 9.5% of their box one W-2? What can you afford to do? And this is a calculation that you can do pretty easily on a spreadsheet. Go home tonight and say, I have 100 employees, and I'm going to charge them all $88.43 a month. That's one number. Or I have 100 employees, I know exactly how much they're making, and I'm going to charge them 9.5% of their W-2. Those contribution numbers are going to be very, very different. That means you're going to pay a lot more or a lot less for your health insurance. Yes, sir.
Back to something you said, we're going to go 60% minimum value. What does that mean exactly? Does that mean that 60% of the claim amount is covered? Is that what that means?
That's a really good way to describe it. So what does a 60% minimum value look like? And what I'll say is, without being too insurance-y, you can kind of equate it to a 60% co-insurance in the network. So most of you are doing much better than that with your employee benefits today, but in the future, your base plan is going to be around that 60% co-insurance. It's going to kind of look like that. You're going to see some 60% minimum value plans with a $5,000 deductible and 80% co-insurance. And once you put it all into the calculator, because there's this very specific calculator, it's going to equate, that particular plan design at 80% co-insurance, $5,000 deductible, about 73% actuarial value or minimum value. So it all depends on the numbers. That's what you'll do a minimum plan, and you'll do some buyout options. Now, as long as you are affordable on the minimum value plan, you can charge your employees more for the buyout options, just like you do today. Questions about affordability? Yes, ma'am.
Next year, when we start going to this value-based type plan where you're gonna charge 50% more on the smokers, can you pass that on through this?
Can you pass on the cost to your employees? Are you large or small?
Small.
Yes, absolutely. Absolutely. You can still have cost-sharing provisions on small employers that far exceed 9.5% of W-2s. You can do 50% premiums if you want to.
Okay.
Yeah. And remember, we only care about employee-only premiums. We don't care about dependents, we don't have to pay for it. We don't care about spouses, we don't have to pay for it. So put this in perspective. And I put this chart in here so you can kind of think about how much are you paying your employees and what will their actual contributions look like. Now I made this pretty simple and I didn't have any pre-tax deductions on that right-hand side. So if you have someone making minimum wage an hour, $7.85 an hour, their contribution is about $130 a month for health insurance. Go all the way up to someone who makes just under $44,000 a year. Their contribution is $345 a month, or could be somewhere around that number, based on this affordability factor of 9.5%. So it gives you some real life examples, and you can plug your employees in there and say, well, how much would they have to contribute under this scenario? So what are the penalties? There are two different formulas for penalties. The first one is this. I offer no coverage whatsoever. I'm a large employer. over 50 full-time equivalents, and I offer no coverage. Under this particular penalty, if any of your full-time employees, because remember, we don't care about part-time employees, receives a tax credit or a subsidy, however you want to call it, inside the marketplace or inside the exchange, then you are faced with a penalty, Mr. Employer, of $2,000. So if you have 100 employees, all full-time, you offer no coverage. There is a little caveat. You get some freebies. The government gives you the first 30 for free. And after that, as a large employer, then you start assessing the penalties. So say I have 100 employees, all 100 receive a subsidy because I only pay $7.50 an hour. All 100 go to the federal government and say, I need your health insurance, I need a subsidy, can you help me? And they say, sure. Then I pay the $2,000 tax, excise tax, by the way, non-deductible. It didn't really take you $2,000 to pay it. It probably took you between $2,500 and $2,800 to pay it per employee. So I pay that on 70 employees. $2,000 times 70. Now, they will bill you monthly, so you don't have to pay it all the time. Very generous of them. If you offer coverage that's unaffordable, maybe you charge 9.8%. Maybe you messed up and you were charging people $90 a month when they were supposed to be $88.43. Maybe you messed up your plan design. There's a lot of little gotchas in here. Then you are also charged a penalty, tax, or fine on that one as well. You still get the first 30 for free. So either way, no coverage or coverage that you just did wrong, even if it was an accident, you could possibly be charged with a tax. Yes, sir.
If I have less than 30 full-time employees, did I hear that I do not have to pay a penalty on those 30 or less if I don't offer them insurance?
You are so smart. Remember the very first example that I used in the beginning where I had 25 full-time employees and I had 40 part-timers? But once we did the math, I was at 51.6. Remember that example? I get the first 30 employees for free when it comes to a penalty. I don't have to offer an insurance in that example that I gave you in the very beginning, and I pay no penalty at all. Remember the employer I told you, 12 states, janitorial company, 850 bodies? By the time I was done with him, he only had 30 full-time employees. Why did I get to 30? Because if he doesn't offer health insurance to those 30, he still pays no penalty. Even though he has 1,200 bodies on payroll, he pays $0 in penalty.
If the FTE is 50, okay, we're a large employer, but in actuality, I only had 15, 30 plus hours. That's what I'm talking about. I'm still exempt from that bill.
Absolutely. You get 30 for free.
Wow, that might be much.
Sure. I like jewelry.
So, back to we're talking about the measurement of the part-timers. So we offer coverage that I have 14 part-time employees, I'm trying to keep it 28 hours. 14, does that mean that I can go ahead and allow them to work 32 hours and not offer them and not have to pay the penalty?
How many total FTEs do you have?
I'm in a large.
Okay, so how many full-time employees out of the large do you have?
I'm 43.
You have 43 full-timers. So you will pay the penalty on only 13 of them if you don't offer health insurance.
If I do offer health insurance, but not to the part-timer that might get above the 30 hours.
Then you're going to pay the penalty less 30. So whoever you messed up on, say the 14 people that you messed up on, you get the first 30 for free. And the trigger is this. Here's how you're clocked. One of your employees, one of your part-time employees who says, okay, hang on just a second, I work more than 30 hours a week, where's my health insurance? They're going to go to the federal government and do the exchange, they're going to fill out the application, and they're going to get subsidy. That's how you're clocked. So one of your employees.
That's a free, that first one.
The first 30 is free. Yeah. I'm sorry?
Per month?
Oh, per year. Yeah, the first 30 are free.
So really, when I'm looking at the overall scheme of things, I don't have to punish these 14 people because their hours way back if I'm just trying to avoid the
then you don't count them at all. You'll waive them out, and they're not going to be subject to anything. So they have qualified health coverage. So you don't count those guys. Yes, sir.
How many of the exchange? Do I understand correctly, is every state mandated to create an exchange?
We're going to talk about that in the next slide. Do you mind if I put you on for just 2 minutes? I promise I will answer. In your packet, for those of you who wanted to buy one, in your packet, I've given you some penalty examples. These are legal ways, okay, to avoid penalty if that's one of your strategies. Some of you are going to want to push the envelope. I fully stand behind. Remember, I'm extremely conservative when it comes to health reform laws. I do not want to see you pay a penalty. I think all these scenarios, all 4 of them, are tried and true. As of today's laws and rules, I think these are all very good. So put them in the packet, review them, if you have any questions, I can help you, or the CIP team can also help you. All right, so let's talk about the marketplace. When it first started, the first original bill was called the exchange. The exchange was supposed to be just like Expedia, right? I want to go to Dallas from LA, I want to fly on Thursday, come on Sunday, tell me the airlines, the price, the times I can fly. That's how they built it to us. It was supposed to be very, very simple. Turns out, now that it's actually on the ground, I'm actually one of the lucky people in this country who got to demo the product. I don't know that I really feel lucky after I demoed it, but it works more like TurboTax. So what it is that it's a 21-page online application. Not 21 questions, but 21 separate screens. The little next button at the bottom. Starts out very simply. What's your name? What's your social? Where do you live? What are your contact numbers? Who are your dependents? What are their socials? Where do they live? Goes on and on. Next one is, I'm about page 7 now. Who do you work for? What's their name? What is their location? What's their employer identification number, their EIN number? Do you routinely give that to your employees? You do once a year on their W-2. Yes, you do. They're going to come ask you for it. Another way you're going to get caught for penalties, by the way, your EIN number will be tracked to your employer, to your business. So if one of your employees puts your EIN number in there and gets a subsidy, guess what? Here they come knocking. It's going to be exciting. The next screen comes to, are you a registered voter? If not, let's get you registered. Click this button. Then the next screen pops up around number 17. It says, congratulations, Misty Baker. We see that you made $40,000 last year. We see that you filed a tax return. We see you have 2 qualified dependents. Congratulations, we have qualified you for a subsidy. Now this seems very easy and a very simple process to go through. It takes between 45 minutes and an hour. I was completely bored by page 5. Your employees are going to go through this exercise. So when it popped up to the screen, it said, congratulations, Misty Baker. We see you file a tax return. We see you qualify for a subsidy. What it really told me is this. Homeland Security verified that I was a U.S. citizen or legal U.S. resident. Social Security Administration and IRS confirmed that I filed a tax return last year and exactly how much money I made. They're all coordinating together in this marketplace. All the information comes to one hub, and it gives you an immediate subsidy answer. It also pre-screens your entire family or anyone that the information that you've entered for Medicaid and CHIP all at the same time. So it's a 3-for-1 application. Now, if you were to print out the application itself, it would be 60 pages long. 21 of them are things you have to fill out. The other 40 are to clarify what you should be putting in every single box. So you know when you print out your W-2s every year, you get 5 pages of instructions and 1 page W-2? It's about the same ease of filling out a W-2 as that you will in the marketplace. So every state will have a marketplace or an exchange. There is no option. The option was this. Does the state create it and pay for it? Or does the state say, forget it, I'll let the federal government come in and do it for me? Which one do you think Texas chose? Texas is not going to open up our checkbook and say, we believe in health reform, we want to be a part of it, we want to form our own exchange. There are good and bad reasons for doing your own exchange, although I will tell you from a purely academic perspective, there were not a lot of choices to make if you filed your own exchange. You got to maybe create a logo and name it something snappy. and you got to create the people who are going to be in it, but really it's not worth the cost. Let me tell you about the cost. In the original health reform bill, they allotted $2 billion to create exchanges. As of this week, they've doubled it to $4.4 billion just to get these babies up and running. That's a lot of money. So we will have an exchange in our state. It will be run by the federal government. We have very few options. The options, one of the options that's going to happen is that you as an employer, I don't care what size you are, must tell your employees that an exchange is available to them in our state. The federal government is going to give you a form letter. It's the best free marketing I've ever seen in my life. So basically it puts all the burden on you as entrepreneurs, and it says, you must provide this 1 page or 4 page, who knows what it looks like yet, because it's not out. It was another thing delayed. Supposed to be out March 1st. We think September 1st is when it's going to come out now. You have to give it to your employees. You better document that you gave it to them. And what it's going to say is this: in your state, a marketplace is available to you. You could receive a subsidy if you purchased health insurance through the marketplace. Let me tell you what the marketplace is really going to look like in the real world. It's going to be a 60%-ish plan. For some of them, they'll buy 70% plans because you receive better subsidies if you do that. You'll also receive some better cost sharing through lower deductibles and lower maximum out of pockets if you buy a silver plan. It's not going to be the robust network that you enjoy today in the private world. Instead, and I already see evidence of this because the doctors are being recontracted who want to participate in the exchange. Doctors are being recontracted. So instead of 50 pediatricians, you're going to have 10. Skinnying down the networks is going to happen. And so what we see right now in the insurance industry, and we have for the last 20 years, is this. You have Medicaid, and I'm going to make up some numbers for ease. Medicaid docs who see Medicaid patients, they get paid 10 cents on the dollar. CHIP is 12 cents. Medicare is, say, 14 cents. The exchange, the brand new level we're going to introduce and say maybe they're 16 cents. And then you have the private pay, 25 cents. Where are your doctors going to want to see patients? Private pay. So when you call up today to make an appointment, they always say, tell me about your insurance. Who's your insurance carrier? Give me the policy number. Do you think they're doing that for their health? No. They want to know who's Medicaid. How much am I getting reimbursed for this particular visit? So you're going to see the class system probably for the first time in your life, unless you're a Medicare recipient. Medicare recipients already know about this. Because like my mother, when she turned 65, she had to have a brand new pulmonologist. Her pulmonologist on her private plan did not participate in Medicare. Same thing happens there. We'll see the same thing happen in the exchanges. There is a small provision for small employers called the shop exchange. Quite frankly, it's not very exciting. Part of the provisions have been put on hold. I did put some information in your packet about some tax credits you could receive. In my opinion, there is no good reason as an employer to go to the shop exchange. It'll cost you more headache, more red tape, and your earnings are far better when it comes to choices than the federal government could ever be. So we're almost done. I'm going to hang with you for 10 more minutes. I promise I'll wrap this up. If you can take
Our corporate offices in Texas, so we have offices in California, we have offices in Pennsylvania, I've got employees from all 50 states. Is it based on Texas exchange, or is it based on what office they're housed out of, or is it based on their
to determine minimum value coverage, but it's not set in stone yet. It's all still in the weeds. That's why you have to come back in September. We have to do this all over again. And we'll have more information. Yes, ma'am. No, because there is no affordability factor in small group. So small group will see some of their population move to the marketplace, and the employer is not impacted with the penalty-wise because there's no penalties for small employers. Yes, sir.
So if you are a large employer, you just decide I'm not going to offer coverage, but only one of your employees goes to the marketplace. Are you going to be penalized just for him, or are they going to go back and find out that you have 60 employees and charge you for all of them?
What they say is that it's only based on those employees, full-time employees, who are receiving a subsidy. That's what they said. So if only one of your 60 went and received a subsidy, then you're not paying a penalty because you get the first 30 for free.
Even though you got 60 employees.
Right. That's what they say.
So if you got 60 employees and you're going to gamble that only 30 of them are going to go out there and get it, you would still be.
You can gamble, sure. I will tell you that this particular, these subsidies and the costs are unsustainable in the long term. I don't know how we make enough money to make all this happen. So I would anticipate that the federal government will put more boots on the ground to help you audit your books and comply with the law. One question. Yes, sir.
Very quick, on these penalties, these individual penalties, is it the dollar figure or the percent of taxable income, or which is greater?
Whatever is greater.
Okay, so it would be.
Yes, ma'am.
If they waive coverage and go out and find that they cannot find it more affordable, do you have to allow them to go back into your plan?
Nope, open enrollment closed. So if you are outside of your open enrollment window, there is no triggering event. Now this is today's rule, today's law. There could be, and it would not surprise me one bit if the government came in and said, you have to open enrollment later on. But as of today, and the rules I see proposed now, it is a one-time open enrollment period. So in your example, no, they don't get to go back in. Yes, ma'am.
I have a different question. Right now, if you're under 26, you can still be on your parents' insurance. Is that going to continue?
Yes, absolutely. The slacker law is absolutely going to.
We have people that are under that age and they're covering their parents. We don't have to count them.
Right. And when they age out, then that's a qualifying event to come on your health insurance. I tell them I have 2 teenage boys, 16 and 13. I say you are off my payroll before you're 26 boys. There's some calculators in your packet. I know some of you need to wrap it up and go. So calculators in your packet will actually talk about if you don't offer health insurance, you just quit doing all that, what is the penalty going to have on your business? And it talks also about there's more than just a $2,000 or $3,000 penalty. There's a lot more than that. The excise tax, who's going to work for you, so on and so on. There's also a subsidy calculator I want to make sure to include and talk about just briefly, and it's this. I want you to stop being an employer for just a second and just be a person in your household. Maybe you have 2 kids and you have a husband. There's 4 of you total. 80% of Americans will at some point in 2014 make a healthcare choice. Am I going to go to the marketplace? Am I going to stay where I'm at? Am I going to buy an individual health plan? What am I going to do? 80 million people are going to think about it. I want you to think about it right now. I'm a family of 3. I got 2 starving teenage kids and myself. So I look at my actual income. So if I earn between $0 and $25,390, I automatically qualify for Medicaid. That's the box I'm in. But if I make more than $25,390, all the way up to $76,360, the government still wants to help me with the subsidy for my insurance. So I would pay somewhere between $52 and $60 per month for me and my 3 children. Now remember that that's a 60% value plan for this skinny network. So I'm really ratcheting down the benefits here. Not a big, robust, everything's free kind of benefit. Put your own family household on. Are you a family of 4, 6? How much money are you making? The government says a family of 4 who makes $92,000 a year is poor. They need some help with their health insurance. And they're going to help you. I want you to look to the left and the right of you, because every person in this room might qualify for a subsidy. So if you think you're going to skip over this part of the law, you think this part of the law is not going to have an impact to your bottom line, you're wrong. Those subsidies come from somewhere. We don't just print the money. Actually, we kind of are just printing money. Sorry, but that was bad. The questions for your company. Number 1, do you have a qualified broker or agent? That is key for your success in 2014. You are not going to know the rules and the laws as they change. You're not going to know what options are available to you. You can't possibly know it all. Is it better for you to change your plan design as a small employer? What would it cost if you hired 2 more people and now you're large? The NCW team is going to help you work through these issues. Secondly, if you're large, do you pay or play? Some of you are gonna go to your office and you're gonna say, I'm gonna get 30 for free. I only got 45 people, I'm taking a chance. But on the flip side, who works for you if you don't offer health insurance? So are you gonna be able to retain and attract good quality employees? Maybe you need health insurance yourself. And so that's why you do it. You still enjoy the write-off, actually, if you have your employer claim. I want you to go back to the office and start calculating your look-back period. If you're a large employer, start firing it up from January 1st. It's easy to do. Use the software that you already have, but put it somewhere. So you give yourself a full 12 months and say, okay, what's my look-back period? What's the best 3 to 12 months that I should use? You also want to budget for rate increases in 2014. Do not stick your head in the sand and think things are going to go away. We've already had the election. We've already had the Supreme Court. And for as many times as I hear people come in and say, well, did you know Oklahoma has a Supreme Court case? We're going to throw Obamacare out the window. I'm done with all that, right? I don't love this, but it's here. It's not going away. So prepare your company for what's going to happen in the future. So I get to travel around the entire state of Texas, and I look at, and I see you looking at me in the first 20 minutes, like you want to kill me. I totally get it. Remember, I didn't write the law, I'm just trying to help you manage it in the future. People tell me a lot of, they're going to go home and they're going to fire people. They're going to go home and make people part-time. They're going to go home and pay the penalty. I hear it all. Whatever strategy you pick is fine, but pick something. Just get on to a solution for your company and be prepared to pay whatever it is that you have to pay in order to make that successful and to stay in business. One of the things that I firmly believe in, because I'm an entrepreneur myself, or I used to be, was that we will figure out a way to make money. We always have. That's why we're self-employed. That's why we hire these massive amounts of people to come work for us. We're visionaries. We push the envelope. We're really good at this. Don't lose that entrepreneurial spirit just because health reform laws. Forbes came in and did an article in November of last year, and it said, CEOs, if you think you're going to dump your insurance and pay the penalty, you're going to lose the best people that you have. I firmly believe that. If I lost my health insurance, my parking spot, I'm out of there. Go work for somebody else. Finally, I didn't make this stuff up, but I did editorialize once in a while, so don't hold that against me. But for the most part, everything I've talked about, I can put guidance to it from the IRS. All of these are IRS guidances. You can see Department of Labor sometimes in there as well. So I will be here to answer any questions that you may have afterwards. The NCW team is also going to stay after and help me. Thank you very much for coming.